Welcome back. It used to be that head and neck cancers were found in people over 60 with significant history of alcohol or tobacco use. But in recent years, more of these cancers have been found in much younger patients who have not used tobacco or alcohol. Our Katie LaSalle takes a look at what's changed and what you can do to prevent it.
Dr. Paul Vandersloot, head and neck surgeon from Swedish Medical Center, joins me now. Doctor, thank you so much for taking the time to talk with us today.
Well, thank you. Thanks for having me.
So when it comes to head and neck cancers, there seems to be a range of types. So what are we really talking about when we hear head and neck cancer?
In most cases, we're talking about lesions that begin within the lining of what we call the upper aerodigestive tract. That's the mouth, the nose, the throat, the voice box, kind of the upper swallowing tube. That's what we're talking about.
Are there specific risk factors that we at home should be looking for or talking to our doctors about?
Traditional risk factors for head and neck cancer have been smoking and excessive alcohol consumption. The two of those, rather than being additive, being multiplicative in terms of increasing the risk of cancer. So both of them imply about a 10 times risk of cancer, but the two of them together imply about 100 times risk of cancer. Wow. The other kind of more recent development, and this is when we say recent, we're talking over the last 20 years, over the course of my career, is cancers related to the human papillomavirus, which have become what the NIH has called an epidemic cancer in the region of what's called the oropharynx, which is the back of the mouth, the region of the tonsil, the back of the tongue, and part of the soft palate.
So are there any symptoms that we at home should be looking out for when it comes to these types of cancers?
Sure, there are a number of things that we should be kind of thoughtful about and be looking for. The straightforward ones are having a lesion that you can see. Sometimes in the mouth and the throat, that can be difficult. But other things that are maybe less obvious are having recurrent bleeding from the mouth or the throat. Having nodules in the neck, a lump in the neck of some sort is often a sign of metastatic disease from a cancer in the mouth or the throat. Difficulty or pain with swallowing, that's an important one. And then maybe one a little less obvious that we see often is what's called referred pain to the ear. So cancers in the mouth and the throat can have pain in the ear, even though there's no pathology in the ear, and that's because the nerves that subserve those areas are uncommon.
And you touched on HPV. So the vaccinations for that are definitely one step forward to preventing head and neck cancers, but are there other things that we can do?
Just living a healthy lifestyle, doing things that support your immune system overall, exercising, eating well. Those are all things that help always prevent us not just from head and neck cancer development, but from other cancers and other medical issues. But obviously not smoking, not drinking excessively. And then when you get into the HPV realm, you're talking about being vaccinated, of course, very important. And also kind of because that's considered a sexually related disease, an STD of sorts, understanding that risk as well.
Dr. Paul Vandersloot, thank you so much for your time today.
You're very welcome.
And we have more information about head and neck cancer available on our website. You can find it at denver7.com/yourhealthmatters.